Hello, I'm State Representative Carrie Rheingans. I represent the 47th District, which includes parts of Western Ann Arbor, Western Washtenaw, and Southeast Jackson County. Thank you so much for coming today for your Advocacy Day and for all the work you do every day, working with people who are experiencing addiction and working really hard to get into recovery and in recovery. And thank you for being here in Lansing and advocating for yourself as a worker and for the people that you serve. I am sorry that I can't be there with you today. So I wanted to send this video to give you a little bit of information about my background so that you know you have an ally in the legislature and talk a little bit about a couple bills I'm working on for this term. So my background, I started working in the field of health policy around 15 years ago, working in the world of HIV and AIDS. And at that time, I was working at a local HIV organization called the HIV/AIDS Resource Center, or HARC, which has since merged with AIDS Partnership Michigan and is now part of Unified. And so I got my start working in this field as a person doing outreach and education, handing out condoms, doing HIV test counseling. And also, I worked in our syringe service program at that time, where we had to beg local municipalities to let us operate. And it was really, I learned a lot, and I take that with me every day when I continue to do my work in the legislature. After that, I went back to graduate school because I was really interested in working on public health and organizing, community organizing issues. And I got my Master of Public Health and Master of Social Work at the same time from the University of Michigan. While I was there, I did continue working at the local HIV organization and doing work with HIV orgs across the country and even around the world. I did a lot of organizing with youth and youth activism. And we really learned about how to push policy levers and do advocacy for the world of policy. And after grad school, I worked at a local here in Ann Arbor, based at the University of Michigan, a health policy center as the Affordable Care Act was rolling out. And at that health policy center, my job was to organize clinical organizations, social service organizations, and help people connect and collaborate in order to help people enroll in new coverage options under the Affordable Care Act. And we really focused on low-income residents of Washtenaw County. After working there for about 8 years, I took a position within the Michigan Department of Health and Human Services, where I oversaw a $3.5 million grant to try to increase provider capacity for substance use disorder treatment and recovery services. And I joined the department in February of 2020, which was kind of rough to join MDHHS right as the pandemic was being declared all around the world and here in Michigan. And so my grant program, which was supposed to be about 18 months, ended up being 3 total years. And during that time, we contracted with University of Michigan Institute for Healthcare Policy and Innovation and some researchers to help interview Medicaid beneficiaries and people across the state providers, as well as patients around substance use disorder treatment and recovery services, and learn some ways that we might be able to increase provider capacity to provide a little bit more service here, a little bit more there, depending on the provider type. And that's where I learned a lot about some Medicaid policies and ways that there's some administrative changes we might be able to make just within MDHHS in order to address addiction and recovery issues, as well as legislative actions that we could take. While I was at the Health Policy Research Center, there were some changes in our state laws around opioid use and prescribing and monitoring prescribing and limiting how much can be prescribed of various prescription opioids. But as we know, the big issue recently has been fentanyl being mixed in with other substances, including street heroin and other opioids, but along with other drugs that people think they're taking and not having any opioid in it. And this has really affected the amount of overdoses and deaths we see in Michigan. I decided to run for this office in part because I thought there were legislative things we might be able to do to address addiction and overdose crisis in our state. And I thought there were funding levers that we might be able to push. From within the department, I saw there were some restrictions in our state laws that make syringe service programs or even safe injecting sites very difficult in different parts of our state. And so that leads me to tell you a little bit about what I'm hoping that we can do this term or in near terms, if it can't happen this term. Things like decriminalizing fentanyl test strips, making sure they're not part of our drug paraphernalia punishments here in Michigan, things like injection uh, materials or however it's phrased in our law at the moment, that is what is not allowed to be used. Removing that from our drug paraphernalia laws. And then also if there's any sort of way to make enabling legislation that would enable syringe service programs to be more easily implemented in places across the state. And then maybe, if possible, maybe not this budget in fiscal 24, which we're working on right now and would start in October 1st of 2023, but possibly the fiscal year after that, thinking about how we might be able to appropriate funds to support syringe service programs, or outside of legislation and appropriations, how might we be able to, as a legislator, help our state's legislative opioid commission and have them work with the Department of Health and Human Services, which is part of the governor's opioid task force, and make sure that the task force and this commission are really working together and sharing information and aligning funding recommendations. The department has a lot of federal funding coming in and is dedicating a lot of really smart staff and dedicated, passionate staff to working on programs within the Department of Health and Human Services, but there's also folks on this legislative council that really want to make sure that we can spend opioid settlement dollars at the state level and at the local levels in ways that will help address opioid use, overdoses, and deaths. So I'm hoping to help bring them together and have more conversations about what we might be able to do in the coming year or two. I know we have opioid settlement dollars for 18 years, so we have a little bit of time to get it right in the moment, instead of just rushing into it and trying to decide everything for 18 years right now. I think the conditions will change and laws might change. We might have syringe service program enabling legislation that would be able to help us direct funds in a different way. So again, I'm sorry I can't be with you today. I am happy to talk more with folks because you have experiences that I don't have in your job and in your life. My mother did die from addiction to alcohol, and she died only a couple months before my daughter was born, and my daughter's about 6.5 right now. So this touches me personally, and I think we've seen a lot more attention on addiction as a medical condition in the news and in people's minds and hearts. And I think that now is the time for us to really keep pushing on that and keep our loved ones alive and keep them here with us, because we know that the world is better with our loved ones here in it. So thank you again for being here in Lansing today. Keep up the good work. It's hard, but you are doing a great job. And you know that I'm always here cheering for you. Thank you so much.